Hey there, and welcome to your NCLEX Art and Preparation session. Get ready to take your exam preparation to the next level with these practice questions. On your screen, you'll see two main sections, the question on the left and the answer choices on the right. But here's where it gets interesting. I'll read each question out loud, and as I do, you'll see a red highlighter moving along, keeping you focused on exactly what matters. Once I finish reading the question, you'll have some time to think through your answer. Keep an eye on the timer in the top right corner. It's your countdown to make the right choice. When the timer hits 0, we'll break down each option together. I'll show you why the correct answer is spot on, and we'll dive into why the other choices just don't fit. Plus, I'll share some pro strategies to help you tackle questions like a true NCLEX champion. Ready to crush it? Let's dive in. Let's see a case study. Please go through the history and nurse notes. Mrs. Margaret Thompson, 80, was admitted with weakness, shortness of breath, and confusion. She has hypertension, type 2 diabetes, and osteoarthritis. She appeared fatigued and disoriented with cognitive decline noted by her daughter. The vital signs are given over here. The medications given are metformin, which is 1,000 twice daily for diabetes. The side effects are GI upset, rare lactic acidosis. Lisinopril, which is 10 milligrams daily for hypertension. Side effects: cough, hypotension. Ibuprofen 200 milligrams every 6 hours as needed for arthritis pain. Side effects are GI bleeding, renal impairment. The lab report is given here for elevated fasting glucose and HbA1c indicating poorly controlled diabetes. Elevated BUN and serum creatinine suggesting renal impairment. Elevated CRP indicating inflammation. Let's see the question. What is a potential concern in managing pain for older adults with arthritis, especially those with hypertension? The given options are A. Increased risk of cognitive decline. B. Adverse effects on renal function. C. Improved cardiovascular health. D. Enhanced joint mobility. I'll give you some time to think about the answer. Correct answer is B, or adverse effects on renal function. Arthritis pain management often involves nonsteroidal anti-inflammatory drugs, NSAIDs, which may pose a risk to renal function, especially in older adults with hypertension. NSAIDs can lead to fluid retention and increased blood pressure, potentially exacerbating hypertension and causing renal impairment. The incorrect options are A. Increased risk of cognitive decline. While chronic pain may impact cognitive function, the primary concern with arthritis pain management in this case is related to renal function due to the use of NSAIDs. C. Improved cardiovascular health. Pain management strategies may impact cardiovascular health indirectly, but the primary focus is on potential adverse effects on renal function, not cardiovascular improvement. D. Enhanced joint mobility. While the goal of arthritis management is to improve joint mobility, the question specifically addresses concerns related to hypertension and pain management. The use of NSAIDs and their potential impact on renal function is the primary concern in this context. If you're watching this video and feeling the pressure of tackling those challenging NCLEX RN case studies, you're not alone. But what if I told you that the strategies and tips we're discussing here are all pulled straight from a game-changing resource designed to take your exam prep to the next level? Actually, the strategies for the case studies in this video is taken from NCLEX RN Case Studies Exam Practice Bootcamp. This book is packed with over 100 in-depth case study questions, each carefully crafted to bridge the gap between theory and real-world clinical practice. Whether you're dealing with anxiety or feeling unsure about the complexities of case studies, this book is the perfect way to transform fear into confidence. With a focus on first attempt success, this bootcamp will not only teach you the right answers, but also guide you through why other options don't make the cut, so you can learn from each mistake and grow stronger with every case. The author has helped countless students just like you conquer their NCLEX on the first try, and now you can benefit from their expertise too. So, if you're ready to boost your confidence, master those case studies, and head into your NCLEX exam prepared like never before, the NCLEX RN Case Studies Exam Practice Bootcamp is your trusted companion. You can find it right now. The link of the book is given in the description below. Fill in the blank choice question. The patient with a history of hypertension and arthritis is prescribed and you are given a dash to manage joint pain. Considering his hypertension, it is crucial to monitor and you are given a dash here too and adjust medications to prevent adverse effects on renal function. The given options are A. Ibuprofen and blood glucose levels. B is acetaminophen and respiratory rate. C. Naproxen and renal function. I'll give you some time to think about the answer. The correct answer are C. Naproxen and renal function. The patient experiencing joint pain due to arthritis may be prescribed NSAIDs such as naproxen for pain management. Considering his hypertension, monitoring renal function is crucial due to the potential adverse effects of NSAIDs on the kidneys. The incorrect options are A. Ibuprofen and blood glucose levels. While ibuprofen is an NSAID commonly used for pain, monitoring blood glucose levels is not directly related to its use. Renal function is more relevant in this context. Option B shows acetaminophen and respiratory rate. Acetaminophen is not an NSAID and is less likely to affect renal function. Respiratory rate monitoring is not directly related to arthritis medication. This question assesses the understanding of appropriate arthritis medication choices and the importance of monitoring specific parameters, especially in the context of hypertension. The question is the fill-in-the-blanks type question. Note that in NCLEX exam, you will encounter some of the filling of the blank spaces or choosing right word or words that matches the context of the question. Your question is given like this with a blank space to fill in. When managing an elderly patient with arthritis, it is essential to assess dash. Please fill the blank here, as these medications may impact renal function. Additionally, regular monitoring of dash is crucial, especially considering the patient's history of hypertension. Please fill up these two dashes. The options given to you are Option A, cognitive function and blood pressure. Option B, joint mobility and blood glucose levels. Option C, renal function and vital signs. I will give you some time to check the answer. All right, the correct answer is option C, renal function followed by vital signs. Arthritis medications, especially NSAIDs, can potentially impact renal function. Monitoring renal function is crucial to prevent adverse effects. Additionally, regular vital sign monitoring, including blood pressure, is essential, especially in patients with a history of hypertension. Other options are incorrect. Option A is incorrect because, while cognitive function is important, the primary concern related to arthritis medications in this case is renal function. Blood pressure monitoring is also crucial but not directly related to arthritis medications. Option B, joint mobility, blood glucose levels, is also incorrect. Joint mobility is a concern in arthritis management, but the question emphasizes the impact of medications on renal function. Blood glucose levels are not directly related to arthritis medications. This question evaluates knowledge related to monitoring parameters when managing arthritis medications in an elderly patient with hypertension. Let us see the next question. Which of the following side effects should the nurse be particularly vigilant for in this case? You have to select two options. The options given to you are A, gastrointestinal bleeding, B, increased blood glucose levels, C, renal impairment, D, cough, E, cognitive decline. Option F, enhanced joint mobility. I'll give you some time to think about the answer. Correct answers are A, gastrointestinal bleeding, and C, renal impairment. For option A, NSAIDs, commonly prescribed for arthritis, can increase the risk of gastrointestinal bleeding. Monitoring for symptoms such as black stools or abdominal pain is crucial. For option C, renal impairment, NSAIDs, including those used for arthritis, may impact renal function. Regular monitoring of renal function is essential to detect any signs of impairment, such as changes in BUN and serum creatinine levels. Incorrect options. Is the incorrect option. Arthritis medications, particularly NSAIDs, are not known to significantly affect blood glucose levels. This side effect is less relevant in this context. Option D, or cough, is also incorrect. Cough is a potential side effect of medications like ACE inhibitors, commonly used for hypertension. However, it is not directly related to arthritis medications in this case. Option E, or cognitive decline, is also incorrect. While cognitive decline may be a concern in elderly patients, it is not a common side effect of arthritis medications. This option is less relevant in the context of Mr. Johnson's case. Option F, or enhanced joint mobility, is also incorrect. Enhanced joint mobility is a desired outcome of arthritis management. It is not a side effect, but a positive effect of appropriate treatment. This option is incorrect in the context of potential side effects. Let's see another question. Hey, if you're looking for a solid resource to practice questions and answers as you get ready for the NCLEX, I've got a recommendation that might really help you out. I recently found the Next Gen NCLEX Art and Practice Question Bank, Big Book of Question Answer Practice, and it was super helpful for preparation of this video as well. If you're trying to get comfortable with the new next generation NCLEX format, this book is definitely worth checking out. It's got daily practice questions that are designed to reflect what you'll see on the exam, which is awesome because it gets you into the right mindset. Plus, after each question, you get detailed explanations so you'll not only know the right answer but understand why it's right and why the other options are wrong. That really helps you build your critical thinking, which is key for the NCLEX. I'd also love that it includes study tips and strategies specifically tailored for the NGN format. And if you're like me and need a little motivation, it has success stories and insights from other nurses, which really keep you inspired throughout your prep. If you're looking to practice and build confidence, this could be a great resource to add to your study routine. It's structured so you can stay on track and focus on mastering the material step by step. Just thought I'd share in case you're looking for something to really help with those practice questions. You've got this. Mrs. Jones is an 80-year-old woman who presents to the clinic with complaints of chronic pain in her knees and hips. She has a history of hypertension and is currently taking lisinopril. She is also taking over-the-counter ibuprofen for pain relief. During the assessment, the nurse reviews her medication list and notices that she is taking ibuprofen. Which of the following statements from the nurse indicates that she understands the potential risks associated with this medication in an older client? The given options are A. Ibuprofen is safe for older adults and should be continued for pain relief. B. We should consider switching Mrs. Jones to a stronger NSAID for better pain relief. C. NSAIDs are generally safe for older adults but can increase the risk of gastrointestinal bleeding. D. Ibuprofen can increase the risk of cardiovascular events and renal dysfunction in older adults. E. We should increase the dose of ibuprofen to provide better pain relief. I will give you some time to choose the correct answer. The correct answers are D and C. Ibuprofen and other nonsteroidal anti-inflammatory drugs should be used with caution in older adults due to their increased risk for adverse effects such as gastrointestinal bleeding, cardiovascular events, and renal dysfunction. Answer choice A is incorrect because it is not true that ibuprofen is safe for older adults. Answer choice B is incorrect because switching to a stronger NSAID may increase the risk of adverse effects. Answer choice E is incorrect because increasing the dose of ibuprofen can further increase the risk of adverse effects. Answer choice C is partially correct as it acknowledges the potential risk of NSAIDs in older adults, but does not specifically mention ibuprofen.